Do you have shortness of breath, or do you get tired easily? Maybe you felt urge to cough, and the next thing you saw was blood in your sink. Maybe your doctor already assumes that you have the lung edema. This can be caused by the mitral valve stenosis. Normally, blood from your veins arrives the heart, and it enters the right atrium. Then it enters the right ventricle. This right ventricle pumps the blood further into the lungs. That's where blood gets oxygenated, and from the lungs, blood comes back to the heart. And now it enters the left atrium. From the left atrium, it's supposed to enter the left ventricle. The left ventricle is strong, and then it can pump this oxygenated blood into the rest of the body. But we don't want this left ventricle, when it contracts, to pump the blood back into the lungs. That's why there is the mitral valve. The mitral valve is placed between this left ventricle. Remember, the left ventricle is the strong ventricle that is pumping the blood into the rest of the body. So, the mitral valve is placed between that ventricle and the left atrium. Because through that left atrium, blood could go back into the lungs, and we want to prevent that. So normally this valve opens, it lets the blood come in, and then it closes as the heart contracts and the ventricle pumps the blood into the rest of the body. But what if this valve is actually narrower than it should be? What if there is the narrowing of the mitral valve? Well, that's what we call the mitral valve stenosis. Is every mitral valve stenosis the same? Well, not really. This is a broad term. It basically only means narrowing, but it can have a variety of causes, and therefore the treatment can also be different. Bottom line is, we can differentiate between the primary mitral valve stenosis and the secondary mitral valve stenosis. The primary mitral valve stenosis means that there are morphological changes in the valve itself. The secondary mitral valve stenosis is the opposite. It means that there are no morphological changes in the mitral valve itself. But what's causing the stenosis then? We're going to explain that in a second. Primary mitral valve stenosis can be caused by a variety of things. For example, degeneration of the valve due to calcification. They can be congenital or caused by autoimmune diseases, rheumatic fever, and so on. A secondary mitral valve stenosis is not supposed to have the morphological changes in the mitral valve itself. So what could cause it? Well, for example, tumor that's exerting pressure on the valve, and that way it's narrowing the opening and it is restricting the blood from coming into the left ventricle. Okay, so enough with these fancy definitions. Let's explain actually how come the patient can have these symptoms and what is really causing the symptoms and what could be the consequences. So if the blood cannot enter the left ventricle, if the blood coming from the lungs cannot enter the left ventricle to be pumped further into the body, well, obviously, it's going to cause an increase of the pressure in the lungs. But where is this blood coming from? The blood in the lungs. It's coming from the right ventricle of the heart. So that means from the heart to the lungs and then back to the heart. So the right ventricle of the heart is pumping the blood towards the lungs. And if we have the increase of the pressure in the lungs, the right ventricle will have to pump harder. the right ventricle has to cope somehow with this increase of the pressure, and it does so by increasing its strength. We call that the hypertrophy of the right ventricle. The walls of the ventricle become thicker and stronger, and thus they can pump stronger. But where is this right ventricle getting its blood from? Well, it's getting its blood from the right atrium, as we already explained. And the atrium is getting its blood from the veins of the body. So we don't want this right ventricle to contract and pump the blood back to the atrium and back to the veins. No, we want this blood pumped towards the lungs. So that's why between the right atrium and the right ventricle, there is a valve that closes and prevents that. This valve is called the tricuspid valve. The stenosis of our mitral valve was causing an increase of the pressure in the lungs and then later in the right ventricle. This further increase of the pressure can actually cause the insufficiency of this tricuspid valve. So this can explain the symptoms. When the left ventricle does not get enough of oxygenated blood and cannot supply this blood then to the rest of the body, then the patient will get tired easily. An increase of the pressure in the lungs will cause shortness of breath and even sometimes coughing of the blood. Furthermore, edema can be caused in other parts of the body, because as we already explained, we could have a situation where tricuspid valve has an insufficiency and it cannot close properly, and therefore the right ventricle is not pumping the blood anymore towards the lungs because that's where the pressure is. It's actually pumping the blood outside into the veins. Well, that is enough of assuming what it could do, shoulda, woulda, coulda. Let's talk about how can we actually diagnose the patient and really confirm, is there a stenosis or is there not? So first thing we can do is listen to the patient and his symptoms, and also we can actually listen to the patient's heart. I mean, quite literally listening to the patient's heart with a stethoscope. We expect to hear a loud S1 sound upon start of the contraction of the heart, and that is caused by the rapid closing of the mitral valve. Now, as the contraction is finished, diastole begins, and what we will hear is an early diastolic snap. It is caused by the mitral valve leaflets snapping into the left ventricle. Following the snap, what we expect to hear is a low-pitched decrescendo crescendo rumbling diastolic murmur. To really understand what this means and to be able to compare it to different pathologies and a healthy heart sounds, we made a special video only for that. Alright, so now what? We heard the patient, we heard his heart, we assume the mitral valve stenosis is the diagnosis. But we really want to see that. What are the possible diagnostic procedures we can do to actually see the stenosis, to see the pathology? We can do the ECG, but we really don't see much over there. Then we can do X-ray. We can look for indirect signs of a stenosis. Then we can do the echocardiography, and there we can see that the valve is thicker. It moves slower, and the opening is smaller. We said that before this stenosis, the blood pressure will be increased, and we can actually measure that increase. We do so by inserting a catheter into a larger vessel That is basically a hollow tube, and through this tube we guide the instruments all the way to the heart, and then we can actually measure the blood pressure in the cardiovascular system. So what is the actual therapy for mitral valve stenosis? Now, when we finally understand the mechanism, how this disease happens and how the symptoms occur and appear, we can actually go for treatment of the symptoms and also treatment of the stenosis itself. There are two ways to go about this. First is the conservative treatment, that is taking medication to control how heart works and also a reduction of possible complications and symptoms. And also a surgical way to replace the valve. So what actually could we try to achieve with this conservative treatment, this medication, and what kind of medication? Well, first things first, when this left ventricle is not getting enough of blood because of this stenosis, it has no blood to supply the rest of the body and also to supply itself, actually, because heart also needs oxygen. What it will do as a response is to actually just pump faster. It's going to start contracting and relaxing faster. This can overload the heart and the oxygen demand might increase. So we want to stop that. So how do we control this? Well, the name for this is tachycardia, and it can be actually prevented by the use of beta blockers, Digitalis, and verapamil. We also want to take the oral anticoagulation therapy to prevent the development of thrombosis in those places of an increased pressure and disturbed blood flow. Surgical replacement of a mitral valve is a rather broad topic, and we discussed that in one of our other videos. If you need more help and information about symptoms, then go to symptomsky.com. There you can find experts and our software for symptoms. If you are studying or teaching medicine, then go to anatomsky.com. There you can find these animations and 3D models in software I made.